My name is Rashmi Halker Singh, and I'm the Deputy Editor of the Headache Journal. I'm here today with two authors of a recent publication called Adverse Childhood Experiences and Onset of Migraine in Canadian Adolescents, a Cohort Study. Nicole Hammond, who is a PhD candidate, and also Dr. Serena L. And we'll talk to them about their recent publication. I think, gaining a better understanding of migraine, especially as this pertains to children and adolescents, is really important, especially better understanding onset and potential reasons and triggers is also really important as well. So first of all, can you summarize your study and explain to us what you found and what you did?
Absolutely. So Rashmi, first of all, thank you so much for providing this opportunity and inviting Serena and I on to talk about our study, which we're super excited about. In short, our study used a large population-based cohort of Canadian children and youth, and we followed them in time. We looked at the data retrospectively, but they were followed prospectively in time. And we looked at long-term relationships between the experience of adverse childhood events when these children and youth were about 4, 5, and 6, 7, and headache outcomes in adolescence, so at 14, 15. And our two headache outcomes were health professional diagnosis of migraine, which was self-reported by the person most knowledgeable on the child, who in the majority of cases was the biological mother. So in more than 90% of the cases, that was the person reporting on our outcomes and the exposures. And then we also had a non-migraine frequent headache group that was an outcome that was self-reported on by the youth, again at age 14, 15. And what we found was that across time, the experience of a variety of adverse childhood events, whether that be parental separation, divorce, fear of abuse, etc., were associated longitudinally with the incidence of migraine at 14, 15. We did not find longitudinal associations for the non-migraine frequent headache group. And interestingly, we did not find that any associations were mediated by symptoms of depression and anxiety, so internalizing symptoms in late childhood at age 8, 9. So we found some nice direct relationships between the experience of adverse childhood events and migraine at age 14, 15, but that relationship was not explained by symptoms of depression and anxiety. So in short, that's our study. It was a large cohort of children and youth. And when they started or were enrolled in the study, they were near birth. So we followed them from about age 0, 1, again, on through adolescence. Serena, is there anything you'd like to add or that I missed in my description of our study?
No, I think that's great. I think the only thing that I'd add is that the study, what's unique about it in the literature, there's other studies that show a relationship between adverse childhood experiences and headache outcomes in children and adolescents, but they were all relying on retrospective report to our knowledge. So this is different in that this was a longitudinal study, which lets us get a little bit closer to inferring causality. And the other thing that was interesting about the results is that we showed a dose response relationship between adverse childhood experiences and the outcome of migraine in adolescents. So what that means is that we stratified the data based on whether participants had been exposed to one ACE or 2 or more. And we found that the relationship between these adverse childhood experiences and the outcome of migraine in adolescents was stronger if they had had a stronger exposure. So 2 or more ACEs was more positively associated as compared to only 1. So the fact that the study was longitudinal and showed a dose response relationship does get us a little bit closer to inferring causality. Not 100% there, no research can.
So in other words, exposure to these adverse childhood events was correlated with, the development of migraine, but depression and anxiety alone was not sufficient. Am I summarizing that accurately?
Yeah, so sort of. So basically, we found a direct relationship between the adverse childhood experiences and migraine in adolescents. What we were hypothesizing is that we would see that, but that relationship would be at least partially mediated through having anxiety and depression after the ACEs, so in middle childhood, but we didn't find mediation. So that means that there's an alternate explanation for the association between the adverse childhood experiences and the outcome of migraine in adolescents.
I see. Well, I think it's really important information. And so based on this study, how can we help these children? And what's the clinical relevance, and how can we help these children who have had exposure to adverse childhood events and, might be at risk for developing migraine? Any thoughts on that?
Yeah, well, that's always the question, is what's the clinical relevance of this? So I think there's a few things that are really interesting about this that could generate hypotheses for future studies and clinical care improvements. So one is that we know migraine is a strongly genetic disease. So heritability estimates are between 30 and 70%. But it's not 100%. And so there must be environmental mediators that can bring out that genetic risk in people. And one of my interests has been to further develop our understanding of what those environmental factors are, because potentially one day, if we really understood that, we could look at primary prevention of migraine, or at least risk mitigation in people who are highly genetically loaded. So that's one thing. I think it opens the door to future conversations and research in that space to understand environmental causality. The second thing is that it speaks to the importance of screening for adverse childhood experiences in our pediatric patients and adult patients, because there's adult data on this as well. And really trying to make oneself as a clinician trauma informed, and screen for trauma and stressor related disorders, because at least from the chronic pain literature, there's less in the migraine literature, but from the chronic pain literature, we know that having trauma and stressor related disorders like PTSD can be associated with worse chronic pain outcomes. And so showing that we have this relationship between adverse childhood experiences and adolescent onset migraine really speaks to the importance of just being aware of whether your patients had that type of exposure and addressing it clinically if there's still symptoms related to it. And I guess the third thing is, why is there this relationship? So I think that's also really interesting. And could this relationship help us understand a little bit more about migraine biology? So what is it about early exposure to toxic stress that might skew brain development in a genetically loaded person towards developing migraine later? And I think that's really interesting, and an area that could definitely be further explored and maybe help us understand the developmental biology of migraine as well.
Well, I think those are all excellent points, and I think this research is really important work, and you guys have shed some really important light on, this topic, because, we know that adverse childhood experiences can absolutely impact migraine, and this is this longitudinal work was something we had not had before. So thank you so much for doing this. Have you started doing any next steps on, like you just mentioned?
In my head, I'm planning next steps. So I do have other ongoing projects that are trying to better understand environmental risk factors in early life related to migraine outcomes. And I've collaborated with some individuals who are looking at epigenetic markers and their association with general chronic pain outcomes to understand if exposure to trauma in early life is related to epigenetic changes that may impact chronic pain outcomes. We haven't gotten specifically into applying that to migraine outside of the general pediatric chronic pain sample yet, but it's definitely one of my goals.
Wonderful. Is there anything else you want to share with our audience today?
I don't think in particular for me, except, I look forward to Serena's future work, but then also perhaps taking some of this ACE work forward in future, and looking perhaps at things like composite measures of, psychosocial risk factors. For this study, we were just looking at symptoms of depression and anxiety. So I look forward in future moving more towards a composite framework and looking at perhaps multiple mediators working together. And like I mentioned, looking forward to Serena's future work on this topic as well. Thank you so much.
And for me, I would just say if anybody's interested in this space and wants to collaborate, I'm always open to discussions and collaborating with new people. So reach out. And very grateful for the opportunity to chat about this work. Thank you.
Thank you so much for this discussion and for, bringing your work to Headache.
Thank you for the opportunity.
Thanks.